So now the question is, why don't we know this? Why isn't this the narrative that we're organized around, some short-term efficacy and drugs that cause these changes? Well, that's what this new book is basically, Psychiatry Under the Influence, is supposed to examine. So after Anatomy came out, I was invited by Lisa Cosgrove, who is a researcher at the University of Massachusetts, Boston, who does research on the conflicts of interest between pharmaceutical companies and psychiatry, to look at psychiatry, the institution of psychiatry, through a lens that was being developed at this Harvard research lab set up to study institutional corruption. So real quickly, the lab, and then what we found when we put psychiatry into this lab. So the lab was funded by Larry Lessig. He's a former dean of the Stanford Law School. And here was his classic example of institutional corruption. He looked at Congress. Now, what is Congress supposed to do? It's supposed to serve the people, right? We elect them. But he says they don't serve the people anymore. Why not? Because they have to raise money from lobbyists to run. And because of that influence on them, they start serving the interests of special interests. So that's an example of an institution that has a public duty, that because of an influence, a financial influence, that its behavior becomes corrupted. So now we're going to look at psychiatry through this lens of institutional corruption. So what are we going to try to do? We're going to try to identify the financial influences that act on the members of that institution and cause them to betray, in essence, their public duty. Now, we all know what the public duty of a medical specialty is, right? What do we expect of a medical specialty? To care for us, to care for the public, to always put the patient's interests first, not the interests of pharmaceutical companies and not their own guild interests. And one of the fundamental principles of modern medicine, and I think it was Irving who mentioned this last night, that came out of World War II in the Nuremberg Code, is informed consent. If you practice medicine on a person, if you do this, you have a legal obligation, actually, to give that person all the information necessary so they can consent in a reasonable way to that medical therapy. So that provides a standard of what we expect from a medical institution. We expect them to be honest in their information they give to us. So how did psychiatry become so corrupt? So here's what we do in this. We look at psychiatry's behavior since 1980, and the reason we go back to 1980 is because that's the year that the American Psychiatric Association published the 3rd edition of its Diagnostic and Statistical Manual. And this becomes a huge sea change in how they're going to conceive of psychiatric disorders. If you look at the first 2 manuals, one in 1952 and 1967, there's a lot of Freudian influences, which say that psychiatric problems have like a psychological component to them. They're basically often a failure to adjust because of unconscious urges, etc. It's psychological. But then what happens in the 19th... And by the way, if you look at the history of psychiatry, it's Freud that allows psychiatry to leave the asylum. So psychiatry as a profession goes back to the 1850s, and it's superintendents, it's doctors who take care of mental hospitals. That's the roots of psychiatry, as superintendents of the severely mentally ill in mental hospitals. And basically for the next 90 years, that's where psychiatrists mostly practice, in the mental hospital. Then Freud comes along, and Freud becomes popularized after World War II. He popularizes talk therapy, and talk therapy allows psychiatry suddenly to say, oh, there's all these sort of people out in the community with problems that we can now tend to on our couches. So now it's that which allows psychiatry to leave the asylum and now have a much larger market, the ordinary people, so to speak, with more ordinary problems. Okay? And as they move out, the idea, of course, is of neuroses, right? That was a Freudian term. Someone could be neurotic, but the beauty of neuroses is you're all a little neurotic, okay? It's not, the idea of being neurotic is not over here are the ill and over here are the well. It's just that we all have degrees of neurosis, etc. But go to the 1970s. What's happening to psychiatry? Well, it is having its legitimacy challenged in many ways. There's some challenge of even what it's doing to people in the asylums, that maybe they're serving more of the social control arm. But even more important, in their talk therapy, insurers are saying, well, I don't understand your diagnoses, and I don't really see if they don't seem very reliable, and I don't really know if your therapies work, so why are we paying for them? And in addition, they're in competition for those patients with a lot of other groups, psychologists, social workers, and people just doing other types of therapies. So like in 1973 at a meeting of the APA, there was this worry. We are headed for extinction. What's our advantage in the marketplace compared to all these other talk therapists? And people say this, you start to see this. Well, we have one thing that the others don't have. What do we have? Prescribing powers. So if that is our advantage in the marketplace, prescribing powers, what do we need to look good in the marketplace to make that prescribing power valuable? You've got to have drugs that are worthwhile. And two, it will really help if you have a conception of all these people you're treating out in the community that they're not just neurotic, but in fact they have illnesses, because we prescribe drugs for illnesses. So in 1980, they published the third edition of the Diagnostic and Statistical Manual, and it is when they reconceive of disorders. They said, yeah, there used to be these psychological components, but we're now going to treat them as diseases of the brain. That's our conception. Now, it was, if you really read, they said these are hypotheses, and hopefully we'll do research that validates these hypotheses, and we'll find chemical imbalances, etc. But this is a new conception. It's a big sea change. They're going to conceive of depression, anxiety, and misbehavior of kids in schools as diseases of the brain. And now, okay, that happens in 1980. So, this is the moment we start to look at in this book about how psychiatry falls under the influence. The first thing we want to do is to identify the growing influence of the pharmaceutical companies once they adopt this new conception. And the minute this happens, the drug industry starts flooding the APA with dollars. So for example, the annual budget revenues of the APA in 1980 were $8 million. By 2008, it was around $65–70 million. And what's happening is the minute this conception has, the drug companies, okay, at the annual meeting, they're setting up their big shops, right? They also begin sponsoring symposiums at the APA, scientific symposiums, where it's being taught by, or the courses are being given by academic physicians, so it seems like science, but those symposiums are actually funded by the drug companies. They pay like $50,000 for every time they have a symposium, so there'd be these big ballrooms, 1,000 people of psychiatrists, everybody getting a free lunch or a free dinner. And then someone comes out here from Harvard, and he says how wonderful these drugs are, how valid this disorder is. So it looks like you're getting a scientific speech. In truth, those speeches were rehearsed with the drug companies, and they were being paid for by the drug companies. And not only is the drug companies paying the APA to give those talks, they're paying me to give those talks. Anyway, so we chart this money that goes from pharmaceutical companies to the American Psychiatric Association, and they begin funding everything. They begin funding public relations campaigns for the APA. They begin funding internships, fellowships. They begin funding, I already mentioned the PR campaigns. I mean, they began funding a campaign to train psychiatrists in what to say to the media. So you just see this flood of money from pharmaceutical companies. That's one flood of money into the APA. The second thing is they begin buying the academic psychiatrists. So before 1980, academic psychiatrists had this sense of you've got to stay away from drug companies somewhat. But now it changes. And by the way, psychiatry is saying we're going to put on a white coat, like we're in internal medicine. We treat the symptoms of a disease, so they have a new image they're presenting. It's no longer the shrink by the couch, it's an internal medicine doctor. And you can see in the archives, they say, how do we improve our image with the public? We wear a white coat. That's the image of the doctor. So this is part of the change as well. But what happens now is 1980, they conceptualize psychiatric disorders as illnesses of the brain, and they have, at that very moment, The APA says we'll start allowing these symposiums at our annual meeting, say on anxiety disorder or depression, and they'll have these famous people up there with academic credentials, and they're going to start paying me to give those talks. And not only will they start paying me, as the great psychiatrist at the medical school, to give these talks, they will start paying me to be an advisor, consultant, etc. Help them get their drugs to market, test. And I just want to give you an example of how some of the money that flowed to individual psychiatrists. Joseph Biederman, he helped eventually open up 2 markets. He's from Harvard Medical School. He's at Massachusetts General Hospital. He really helped develop the market for ADHD and the use of drugs, and then the market for juvenile bipolar. One company, Janssen, who was marketing Risperdal for kids, for juvenile bipolar, paid him $1.6 million between 2000 and 2007. Now that's one doctor for one company. If you actually look at his disclosure list, I think he eventually worked for about 24 companies. How about Frederick Goodwin, former NIMH director? He helped open up a market for the use of a mood stabilizer for bipolar disorder. GlaxoSmithKline paid him $1.2 million between 2000 and 2008. How about AstraZeneca paying Melissa DeBello? She was helping open up a market, I think it was for an antidepressant for kids. She got paid $418,000 over a course of 4 years. My point is the money that was going to the big academic psychiatrists for advising, speaking, and they began to speaking to other doctors, it was really considerable money. Now, how big did this influence become? By 1998, the New England Journal of Medicine was trying to do a review of the efficacy of antidepressants. So they searched the experts in mood disorders, and they said, we need someone who doesn't take money from drug companies to do this review. I said, well, we can't find anybody. The point is, academic psychiatry at a time practically got bought completely. So now if you think about this, you have a trade association that's getting money from pharmaceutical companies. And more important, the very people we look to tell us the truth, to be the experts, they're getting a lot of money from pharmaceutical companies. Now, as that happens, you see why they're maybe not going to tell us about drugs that make things chronically worse? It's just, that's not what that influence is meant to do.